It's time now for the Business Spotlight on the WMAY newsfeed. It's sponsored today by the SIU Center for Family Medicine. Dr. Amanda Krus-Johnston is here to talk about the residency program at the SIU Center for Family Medicine. Doctor, thank you for being here with us. Great to talk to you.
It's great to be here.
I want to make sure we all understand the terms. So can you explain what is the residency program and what is a resident doctor?
So physicians complete 4 years of medical school, and then they are matched to a postgraduate training program. Our program is a 3-year program where we take newly graduated doctors and do on-the-job training to form them into fully functioning, wonderful physicians.
How does a residency program differ from what those doctors are learning for all the years they're putting into medical school? The difference between classroom work and laboratory work versus hands-on practicing?
So in medical school, you do spend a lot of time in classrooms and learning like the physiology and things behind the scenes. In residency, it becomes hands-on. You take all of that knowledge and you put it into practice. You're seeing real patients, they're your patients, and you're treating their diseases, and you're taking all that information you learned and putting it into real life.
We sometimes take for granted, living here in Springfield, the abundance of medical programs and opportunities we have here. What are the benefits to the community for a program like the residency program at SIU Family Medicine?
Oh, the benefits are huge. Our residency program includes rotations where our residents get to go to all the various specialties around town. We do community outreach. Our family medicine program is a federally qualified health center, so we provide care, low-cost care to everyone who needs it. It's such a benefit to have a resident physician. They tend to have more time to work with you. They take the time to definitely get to know you and learn all about you, and they're learning with you. So it's such a benefit to have a resident physician because they're eager and willing, and they will take the time to make sure you get the best care.
If I make an appointment at the Center for Family Medicine, what's the likelihood that I'll be seeing and speaking with a resident?
So when you are a new patient with us, you are assigned a primary care physician, and oftentimes this is a resident because we want our residents to have as much experience as possible. But you don't have anything to worry about with a resident physician because all of the care you receive from a resident physician is overseen by an attending physician, which means it's almost like having multiple doctors looking into your case and making sure you're getting the best care.
You know, obviously, everybody needs experience to hone their craft, and I think we all understand that. But we also understand, too, boy, when it's my own health at issue here, I want to make sure I've got somebody with all the knowledge and all the experience they can possibly have. So talk a little bit more about that, about if you do have or are working with a resident physician, what that means in terms of their experience level and what that means in terms of the care you're receiving.
So just because you're seeing a resident physician does not mean that you're getting skimped on care. They see hundreds of patients a year, if not more, with an ultimate goal of seeing about 1,600 patients during their residency alone. And oftentimes they exceed that by quite a bit. They're gaining on the job experience, but like I said, they always have a fully licensed physician backing them up, with them every step of the way, discussing their decisions, why they're making these decisions, how we can best take care of the patient. And as attending physicians, we have a lot of experience. Some of us in our program have been doing this for 20 plus years. And so you're getting fantastic care from multiple people who we all care about the whole person. We want you to have the best, health that we can. So we partner with our residents because then when they go out and they maybe oversee residents, they pass on that same quality standard.
And it's got to be emphasized again, just to become a resident physician, you've already kind of gone through a gauntlet. You have had to really prove yourself to even be able to attain that status.
Oh, very much so. You've done 4 incredibly rigorous years of medical school in addition to your undergraduate learning. Getting into residency programs is a highly competitive process, and I'm biased, but I think SIU, we get the best residents.
So if people would like to learn more about the resident program or just learn more about the different types of care being offered at the SIU Center for Family Medicine, how do they do so?
They can go onto our website, SIU Med, or they can give us a call at 217-545-8000. We're always accepting new patients, and we are here to take care of you and your family members.
Again, siumed.edu or 217-545-8000 for the SIU Center for Family Medicine, sponsors today of the Business Spotlight here. Dr. Amanda Krus-Johnston, thanks you so much for your time. It's great to talk to you. We do appreciate it.
Thank you very much. Have a good day.
Here on the WMAY news feed, WMAY on 92.7, 94.7, and 970 AM.